Today we have a 6-year-old male budgie with a history of progressively losing function in his leg. Do you know why? Any thoughts? What are your primary differentials? Comment below. This is a common syndrome that we see in budgies, or budgerigars, which are commonly called parakeets. And if you look at this little guy, he's in the cage because he's not real thrilled to be at the vet. You'll see that he's holding his right leg out to the side. When I hold him, he doesn't curl his toes, he doesn't grasp with that foot, but he is still placing that foot. Primary concerns with him is because he's a little bit older male budgie would be things like a gonad tumor or a renal tumor. And both of those can impinge or compress the sciatic nerve, and in budgies will very commonly cause a progressive paralysis. The other differential would certainly be trauma, and something like subluxation or dislocation of the hip would be a consideration. There's no external trauma on this guy, no bleeding, no wounds. And the other thing to consider with this budgie is we have a very flaky beak that's overgrown and is often having to be trimmed according to the owner. And in budgies, when we see that, we always wonder if we have some fatty liver disease going on. It very frequently will show up with beak changes or keratin changes and overgrowth. That may be a factor not contributing to the lameness. The takeaway here is if you see a budgie, particularly a male, and he has progressive loss of function with no trauma, consider a gonadal tumor impinging on the sciatic nerve.